Hello and welcome to HIT 272L, which is the RHIT Exam Review Prep course. My name is Dr. Lisa Campbell, Associate Professor in the College of Health Sciences. Let me be the first to congratulate you on your success. You did it. You made it to the end. This journey is not over yet, as you must jump over one last hurdle, which is taking and passing the RHIT exam. Over the next 7 weeks, you will endure an aggressive review of everything that you learned in the last 2 years. Sometimes you're going to say to yourself, I don't remember. That's okay. The purpose of a review is to evaluate your strengths and weaknesses so that you can be better prepared for the exam. The review sessions provided over the next 7 weeks are designed to assist you with reviewing concepts that you will be tested on throughout the duration of this course, as well as the RHIT exam. Of note, participation in these webinars does not guarantee that you're going to pass the RHIT exam. We know that we have given you the tools that you need to be successful, but what you do with them is ultimately up to you. The sample questions that will be provided in some of our webinars are not meant to mirror the actual exam questions. No matter what resources you are using, we recommend that you do not try to memorize test questions. Rather, you need to learn the concepts that are being presented. In this RHIT prep course, you're going to be reviewing the different domains of the RHIT exam. Various instructors will provide presentations on different domains. You're going to have practice tests. You're going to have graded domain exams. You're going to be completing your RHIT exam application. You must pass this course with a 70% or higher, and DeVry will pay for you to take the exam once. It is strongly recommended that you download, print, and read the candidate handbook, which is available at www.ahima.org. This candidate handbook will answer all of the questions that you may have regarding the RHIT exam. You can also call AHIMA at 312-233-1100. Again, that's 312-233-1100. Let's talk a little bit about your exam application. As already mentioned, you'll want to make sure that you review the candidate guide. The application process for the RHIT exam does require that you submit an official transcript to AHIMA that indicates that you have completed the program. Again, the application process does consist of you submitting your official transcripts from the school that indicates that you have completed the program in its entirety. If you have one class left, you have not completed the program. You must ensure that your transcript indicates that you have earned the associate's degree in Health Information Technology. You will also be submitting an application to the school, and the school will then process your application and submit payment to AHIMA. Let's stop and review. The application goes to the school. Your transcripts are submitted directly to AHIMA. In the candidate handbook, you will find the address to where the transcripts are to be submitted. It takes about 4 to 6 weeks for the school and AHIMA to process your exam application and related documents, after which you will receive an authorization to test email, also known as ATT. The authorization to test email is also explained you know where in the candidate handbook. Did I stress how important it is that you, as the RHIT examinee, review the candidate handbook? I guess I just did again. Once you receive your admission to test, you will have 4 months to take your exam. You will need to schedule your exam following the instructions that are laid out on your admission to test. If you have questions regarding scheduling the exam, you will want to visit pearsonview.com/AHIMA. Again, if you have questions regarding scheduling your exam, you'll want to visit pearsonview.com/AHIMA. All right, so let's talk about this journey that you are about to undertake. I truly hope that you have all of your books saved in your Vital Source app, or you have physical copies, whichever is your preference. Now is the time to dust them out and open them up for review. Let's see. You have Health Information Management Technology and Applied Approach. You had that for HIT 120 and 141. The legal aspects of health information management. You remember that from the legal course. HIT 226, calculating and reporting healthcare statistics. One of the things that you'll want to note is that formulas are not provided on the RHIT exam, so you'll want to ensure that you learn those formulas. Principles of healthcare reimbursement from HIT 230. Your step-by-step medical coding textbook from HIT 211. The ICD-10 PCS and Applied Approach from HIT 203. Basic ICD-10 CM PCS coding from HIT 205. And medical terminology from Health Professions, HIT 111. And don't forget your anatomy textbook, your disease process textbook, and your pharmacology textbook. If you are a student member of AHIMA, which we highly recommend that you join, you can access additional references that come with membership. One in particular is on March 2016, AHIMA actually held a panel discussion with individuals that had recently taken the RHIT exam. In this panel, individuals had given very, very good advice on the do's and the don'ts of taking and successfully passing the national exam. Remember, these are not state exams, these are national exams. Another perk of being a member, membership does have its privileges. Another perk of being a member is that you are able to access the engaged community. Under the engaged community, there is a certification exam prep area. There, you can connect with other individuals that are currently studying for the test, that have taken the test, and that's another place to gain some very valuable insight into the RHIT exam. Let's talk about some review books. Now, I'm often asked, which review book do I like the best? I really believe that you, as the test taker, need to explore the different resources that are available. So I'm going to talk about a few today. Number one, AHIMA does have an RHIT prep review guide. You can purchase this directly from AHIMA. AHIMA's website is www.ahima.org, or you can call them at 312-233-1100. The RHIT exam prep from AHIMA does include over 850 questions, plus some additional online questions. Another resource is the Professional Review Guide for the RHIT and RHIA exam. Just like the AHIMA publication, this book does come with close to 1,000 questions, and it does come with online exams. And lastly, the Comprehensive Review Guide for Health Information, which is published by Jones and Bartlett, also has review questions as well as questions online. One thing that I will note about this particular publication, which is different than the other two. The first two are, they have some test taking techniques in the beginning, and then they have questions, and then, of course, the answers with rationale. One of the things that's unique about this particular publication is that for the different domains of the exam, the author actually starts off with an outline formatted review. What I recommend that you do is go on Amazon, take a look to see if you can see the inside of some of these publications, figure out which one is the best for you. All right, another resource that you will want to be sure that you visit as the test taker is the RHIT exam certification page, which can be found at, you guessed it, www.ahima.org/certification/RHIT. You'll want to ensure that you review the areas of the overview of the exam, applying for the exam, as well as exam prep. As the test taker, it is important that you equip yourself with the knowledge that you need regarding this exam. Let's talk about the exam, because you're wondering, how many questions is the exam? Well, I'm glad you asked. The RHIT exam is 3.5 hours in length. There are 150 questions that you will be presented with, but only 130 of those items are scored. The other 20 are pre-test questions. Here's the deal, guys. You won't know which questions are pre-test or which ones are scored. Only the computer system knows that. But the purpose of the pre-test questions is AHIMA is looking to gather data about how individuals respond to those questions, so they're included, but you won't know what they are. I will tell you, I've taken a few exams with AHIMA, and I think I have recognized a few of them. And the reason I say that is because I read the question and I'm like, wait a minute, that makes no sense whatsoever. More than likely, that's one of those pre-test questions. So, mathematically speaking, you have 3.5 hours, 150 questions. Mathematically speaking, that's about a minute or so per question. The structure of the RHIT exam, known as domains. I mentioned earlier that HIT 272L is divided by domains. Those domains are related to the exams. They are displayed here for you on the screen, and what you'll want to note, data analysis and management is the largest, followed by coding. Data analysis and management, HIT 120, 141, health information management, technology, and applied approach. Remember that book? You'll want to ensure that you read that textbook from cover to cover. If you did not read that textbook during your program, you must read that book now in preparation for the exam. Not only read it, that you understand what you're reading. And while you're in HIT 272L, this is your opportunity to ask questions about areas that you maybe don't quite understand at this point. All right, on all of AHIMA exams, you are tested based on what are known as cognitive skills. Let's talk about those skills now. The first is called recall. Recall is your ability to remember information. The second, cognitive area we'll get to in a second, but let's look at a question. Where is a topical application of a drug? Head, hand, skin, or mouth? Topical application. If you said skin, you were absolutely correct. The second cognitive area is called analysis. That's your ability to apply knowledge to solving a specific problem. Let's look at an example. An example of a topical application of a drug would be, well, you recalled that topical was on the skin. So looking at these four multiple choice questions or answers, which one would be the correct one? Well, let's see. On the skin, skin is dermal, transdermal patch would be the correct answer. And the last cognitive area is called application. So you're taking what you remember, what you analyzed and applied to a situation. One of the things that you'll want to know about the RHIT exam questions, they're not going to be one sentence long. Many of your questions will be what we call situational questions. So it will be like in a paragraph format. This is why it is important that you do not memorize questions, rather that you learn the content, so that when you are presented with a situation, you can apply what you learned and answer the question. So here's another example, and this is application. An indigent patient was seen in the physician's office for UTI, which insurance would reimburse the provider. Something else I'll have to tell you, as you're studying, if you come across a word that you don't know what it means, whether it is English, medical term, if you don't know what it means, you have to look it up. On the day of the RHIT exam, you will not be able to use the internet to search anything. You won't have a medical dictionary in front of you. So, for example, in order to answer this question, you need to know what the word indigent means. So, the answer here is Medicaid. So one of the challenges regarding the RHIT exam is that it really truly is going to look like no other exam that you've taken. Again, a lot of the questions are in paragraph format. They're situational type questions. Some of the questions are going to have a bunch of information, and you're going to be like, oh my God. But you have to get to the end of the question and identify what are they asking me and stay focused on that. Some of the questions may be analysis. Some may be application. Some may be recall. You won't know. You won't know which domain that they're asking you. What you're going to see is one question at a time. All right, so let's delve into some areas that you may or may not remember, but again, it's okay. The purpose of the review is to review so that you can identify your strengths and weaknesses. And here's our first question. So a patient had gastric bypass surgery 3 years previously. As a result of losing over 200 pounds, loose skin hung from the patient's arms, thighs, and abdomen. The patient, upon referral from her general surgeon, was scheduled to have a plastic surgeon remove the excess skin. The patient called for prior approval as required by the plan. The clinical review resulted in a denial of the surgery as cosmetic. The member, which is of course the patient, requested a peer review and submitted documentation from her physician that the excess skin was causing infections and exacerbating her eczema. The peer clinician denied the case. What is the next step in order for the member to have her surgery paid by the insurance company? As you are going through practice questions, you will want to ensure that when you're reading the question, when you get down to the final sentence, make sure that you understand what you are being asked. Don't get caught up in all the minutia of the question. The question at hand, what is the next step in order for the member to have the surgery paid for by her insurance company? So let's look at some options. File a lawsuit, appeal to an expert clinician in the same specialty, schedule the surgery with her original surgeon as that surgery was paid, or disenroll and enroll in another plan. The best answer here is going to be B, appeal to an expert clinician in the same specialty. Next question. Dr. Panner is a pulmonary surgeon. Last week, during one of his operations, Dr. Panner sneezed so hard that his face mask blew off and landed in the patient's chest cavity. Dr. Panner then proceeded to pick up the mask with a forceps and drop it on the floor, and then use the forceps to isolate the blood vessel. A new surgical mask was then immediately placed. The patient had no complications after surgery, but now his record is being reviewed by Dr. Panner's professional colleagues on the surgery committee because of deviation from standard norms. What kind of review is this called? Infection review, concurrent review, malpractice review, peer review, surgical review, risk management review. Now, let's go back because something's very important in this scenario. His record is now being reviewed by Dr. Panner's professional colleagues on the surgery committee. So, Dr. Panner's colleagues here, this would be known as a peer review. Next question. As the release of information specialist in the HIM department, you accompany a patient's records to court following a subpoena ducis tecum order. A patient is suing the physician and the hospital for malpractice, claiming that the doctor ordered medication to which the patient was known to be allergic. Are nurses' notes allowed to be used as evidence? All righty. Let's look at our options. As routine records kept in the line of business, all information in the medical record is admissible in court. Nurses' notes are admissible if they are deemed pertinent. Nurses' notes are considered hearsay. Physician notes may be used, but nurses' notes, not nurses' notes, because they don't have authority to make medical decisions. And then lastly, only lab and x-ray are admissible as evidence. A couple of things here, just so you know, on the RHIT exam, you're only going to have 4 choices. Even though we have 5 here, you're only going to have 4. And so, what's the question? Let's go back. Are nurses' notes allowed to be used as evidence? And the answer is A. As routine records kept in the line of business, all information in medical records is admissible in court. Now, let's shift gears to something that you are more than likely going to see on the RHIT exam. Okay, what kind of diagram is this? We started off with something very easy. And if you said fishbone, you were absolutely correct. Next up, what kind of diagram is this? Here, we're looking at English versus math scores. This is a scatter diagram. This is a scatter diagram. You're going to compare variables here, English to math scores. What kind of chart is this? And I'll give you a hint. If you look at the percentages, that should be something that will clue you in. But this is the Pareto diagram. Remember the 20-80 rule? So this is the Pareto diagram. Next up, what type of chart is this? You should see that there are some decisions being made. There's a start, there's an end. This is a flow chart. Flow charts are used to show the steps in a process. It shows the decision-making points in the process as well. Next question. Your manager asks you to prepare a report comparing the productivity over the last month of 5 coders that you supervise in the HIM department. What would be the best type of graph to use? Fishbone, Pareto, run chart, bar chart, or scatter diagram? What do you think? And in this case, we would use a bar chart. Look at how we are keeping track of 5 coders for the month of February. Next up, Crandall Community Hospital hired a risk manager 6 months ago. The CEO has been tracking the number of incident reports over the last 6 months to see if the new risk manager has reduced the number. So we're looking to reduce the incidences. So we're looking at, over the last 6 months, the number of incidents reports. What would be the best way to display this information? A run chart, because you're tracking the incidences over the last 6 months. Next up, you are the manager of the HIM department. Your hospital is considering the purchase of Dragon voice processor to cut down expenses for medical transcription. What would be the best way to capture the pros and cons of this decision in a graph format? Okay, what you think? The answer is force field analysis. Guys, again, don't be frustrated if you're like, I don't remember any of these. This is the review. The purpose of the review is to really see what you don't know. I highly recommend that you read Health Information Management Technology, an Applied Approach from cover to cover, guys. That's going to be very, 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 very important. Okay, let's see what we have next. As the manager of a coding consulting company, you would like to illustrate the correlation between coding productivity and years on the job. What would be the best way to display this information? All right, here is the run chart again, the scatter chart again. Okay, next up, you are the supervisor of the medical transcription area, and your department is responsible for transcribing a number of different types of hospital reports, surgeries, discharge summaries, you name it. You are supposed to come up with a way to show what percent of your department's output consists of each type of report. What graph would you use? All right, and the answer is a pie chart because we're showing the percentages. All right, so now is the time for you to plan. It is time to get on board with the mission at hand. So let's talk about some final parting words of wisdom in order for you to get started. Number one, you have to have an effective study plan. What that study plan looks like for you is dependent on your schedule. Is it 8 weeks? Is it 12 weeks? Is it 16 weeks? There have been some individuals that have said, okay, I'm going to do this course for 8 weeks, then I'm going to study for another 8 weeks, and I'm going to go right into my exam. Because you'll want to remember, the longer you are away from this material, you may forget the information. Another thing, evaluate your strengths and weaknesses. Guys, don't see your weaknesses as a negative. Now is the time to figure out what you don't know and study. Also, guys, you want to make sure that you have a very solid study schedule. You want to ensure that you don't schedule 3 hours and you only do 30 minutes. Make sure your schedule is realistic. Guys, also sometimes you have to leave the house to study. You can't study at home with all the different background noises, etc. Be consistent in your study schedule. Dealing with test anxiety. If you know that you are someone that deals with test anxiety, you want to figure out now how you can manage that during the exam, whether it's breathing techniques, whether it's, you know, leading up to the exam, exercising to get your body calm, if it's yoga, whatever you need to do to get your body to that place, you want to practice that now. On the test day, you want to make sure that the night before that you get some sleep. That's very, very important. You don't want to take a test that long and you're tired. Also, you want to ensure that you watch what you eat. You don't want to have a big lumberjack meal on the morning of the exam because that will make you sluggish. You want to have foods that will give you energy. Be early for the exam. Wear comfortable clothes. Here's another tip. Don't wear clothes that have pockets in them, okay? Wear pants where when they do the palm printing and checking your IDs and all of that, that you're not having to empty out your pockets and do all of that. So dress, like some jogging pants or something that's very comfortable with the top. You're not going to be able to allowed to wear a jacket. So if you tend to get cold, what I would do, I would go check out the testing center that you're going to potentially schedule your test at and just see, how they're set up in terms of, is it too hot, is it too cold, ask questions. As mentioned in the candidate handbook, you do need to have 2 IDs, so you'll want to make sure that you have them on the day of the exam. You can contact the HEMA to determine what 2 IDs you are allowed to bring. During the exam, guys, pace yourself. Don't spend a lot of time on the questions. Remember, you have essentially about a minute or so per question. Here's what I recommend. Read the question. Look at the answer. If you don't know the answer, mark that question and come back to it. We highly recommend that you take a look at the testing environment for Pearson so that you can see how some of the practice, how the practice room looks. That way you don't go there with all of that level of anxiety. You also want to make use of the whiteboard that you're going to be provided with. It will allow you to make notes. Like let's say you're trying to eliminate something, you're trying to do a math problem. There is a calculator on the computer. We recommend that you practice with the calculator on the computer. So if you have to calculate length of stay, etc., that you're used to using the calculator. Answer all of the questions, guys. Don't second guess yourself. Look for tricky words. With the practice questions that you're using right now, you'll want to ensure that you are learning the content so that way they can't trick you on the exam. Well, guys, this is your introductory review. We wish you the best of luck over the next 7 weeks and keep your eye on the prize, which is the RHIT credential. We'll see you on the other side. Bye bye now.